Hello, ma'am. We have started, so
Yeah,
you can start now.
okay. Okay. Uh, Hello, everyone. This is Dr. Rupal here. Hopefully, we had met in the first session. Today is the second one. I think we already have the ninth session ongoing.
Okay.
Go ahead if you have any question. Okay.
Okay. Hello, everyone. This is Dr. Rupal here. Hopefully, we had met in the first session. Today is the second one. I think we already have the ninth session ongoing. Go ahead if you have any question. Okay. Okay. Um, this is Dr. Rupal here. Hopefully, we had met in the first today. We already have the ninth session.
Hi, Achla. Let's see. Yeah, hi, sorry, Achla. Your question is what to do when mother had C-section and don't have any secretion from breast for 2 days. The reason, mothers, they
Hi,
don't
Achla.
have, I'll just reduce the volume. Yeah, the reason mothers don't have breast milk post C-section because baby is not attached immediately. You know, I would say during cesarean section. So when baby comes out, they have to be, gynecologist has to put that baby on mother's breast. Longer you wait, harder it is for mother to secrete breast milk. Okay. So main thing is that you have to go into preventive mode. So when mother comes to you when she's pregnant, you have to tell her that she has to attach the baby immediately, as soon as baby comes out from cesarean section. Another thing is that uh, even if suppose she may not have lactation during that time, but as soon as baby starts suckling, the prolactin will release and she will start getting milk. As you know, first 24 hours, they don't get much anyway. It's 5 cc or 5 ml or 1 teaspoon per feed per breast, right? So you do not expect a lot of milk coming out on day one, day two anyway. But what I recommend is to, as soon as baby comes out, you keep that baby and do it every hour and two, as soon as baby opens the mouth or as soon as baby's a little bit wriggly, you just put the baby on mother's breast. There is one very good method how to put the baby on breast, especially on day one, day two. You can basically, when mother is lying down on her back, you can put the baby on the side, make baby sit on the bed, and baby can basically breastfeed from the side. Okay, so let me see if I can show you. Let me try. Okay, so I'm going to share my video, and I have a couple of here, this one. Okay, so here you can see. Yeah, you see the baby sitting on the side. Mother just had cesarean just a couple of hours ago, and here baby is sitting on the side. Okay, and look at the neck is extended. Okay, and when we tried to attach the baby, we had made that our fingers were parallel to baby's lips. So we kind of squeezed the breast, so it was easy for baby to breastfeed. And it's important to check the latch. So you press the breast near the lower lip, and just make sure that there are 5 points of attachment that you look at. Okay, so those points of attachments are very, very critical to understand whether baby is nursing well or not. Okay, all right. Any, I don't know whether you were able to see it, but if not, then let me know and I will, okay. Ma'am, sometime family would have started bottle, later comes with difficult latch. How to address nipple confusion when they're present after 2, 3 weeks? Very difficult, extremely difficult, because what happens is, once, especially after 2, 3 weeks, they get so used to that bottle nipple or even nipple shield that it becomes very difficult. So what I would recommend is to really, if you can, uh, teach those gynecologists, nurses, pediatricians, spread awareness in the community so that they don't, start nipple shield or even bottle formulas. So, another thing what you can do, again, it's very difficult for me also to latch the baby once the baby gets nipple confusion. What we can try is to latch the baby when first of all you want to stop a bottle, so you tell mother to stop bottle, to stop nipple shield, or that she has to stop right away. Okay, she can give the top milk for a few days through probably a cup, or little katori. And when baby is sleepy, you try to put the baby, so you can do that. You can do drip drop also, kind of put some squeeze breast and put some breast milk, and baby will open, and hopefully try to attach the baby. It's difficult. It takes some time. You may have to see this mother every day, but as I told you that it's tough. Try to do a lot more KMC, kangaroo mother care. So you put the baby close to mother, and every time baby is hungry, you just attach the baby. So it's slowly, as mother, and you want to make sure that mother is also increasing breast milk supply, by physical methods. So you watch that physical methods of breast milk supply. So you want to make sure that you're doing that. Okay. Now, what if the hospital is not supportive? Achila, then it'll only come with a lot of your expertise. You just keep trying and see what works for you. So that's what I would say is that a few things that you want to increase mother's milk supply. You tell mother to express more milk and give that milk through katori. Okay. So that way she also continue to increase her supply. And then attachment is very important. When baby has a good amount of areola in the mouth, hopefully baby will learn, because normally what happens is those babies also have a lot of nipple feeding from mother, so you not only you want to remove that nipple confusion, but we also want to teach baby how to have a proper latch. And that teaching comes to basically you'll be teaching mother as well as baby. Okay, so those 45 points of counseling, which will come in your last session, 12th session, that will become very, very critical for you to learn. Okay, but it's basically it's a lot of effort which will require, Achila. So try to get into more of preventive mode and more awareness. Hi, ma'am. Have seen a couple of recipes using dry fit. Would you recommend babies less than 1 year of age? Yes. You don't want to put too much of dry fish powder also, but yes, dry fish powder will also have some calcium. So it's definitely it will be, and it's very high on DHAP also. Okay, so those baby will definitely have a good amount of IQ. Those babies require DHAPA. So some amount is good, no problem. Salt, yeah. Um, Make sure that, try to kind of have those dried fish with less salt, but again, a little bit of fish powder, because again, these are concentrated, right? So a little bit of fish powder will not do any harm. Okay. Okay, question from Dr. Monica Raj. Any insight on late pregnancy associated risk? How can nutrition or lifestyle changes or preconceptional care help optimize health for successful in women over 30. Additionally, it is advisable for women to plan a pregnancy early in life to reduce potential complication. So, yeah, there are high-risk pregnancy. So about 35 years of age, when the mother is about 35 years of age, of course, the risk increases. Uh, Good time, it all depends upon your choices, right? So if you get married late, then you may not have much choice. Plus career. So there are a lot of different options. I do recommend to have children, at least in late 20s, mid 20s to late 20s, because, young children demand a lot of time, a lot of energy. When you're young, you definitely have a lot more energy. You have, it's also kind of, you're at low risk of developing any genetic condition in the baby, right? So you want good quality eggs, and good quality eggs are definitely much more when you're younger. So I would definitely recommend to have your children under 30 years of age. If you're 30 and above, nothing to worry about. You just want to make sure that you are not insulin resistant. So make sure that, pre-pregnancy, there's a beautiful video on pre-pregnancy. So increase your protein, decrease your carbohydrate, get out of the insulin resistant phase, have more nutrient dense food, make sure that you're having omega-3, you have your folate rich recipes, zinc, iron. Those are some critical nutrients which are very important. Choline is important. It happens at first 2-3 months. You may, after you become pregnant, there might be a lot more, vomiting or nausea. So you may not be able to tolerate a lot of protein. So you want to build that muscle beforehand. So that way, if you're not eating enough protein in the first couple of months, babies will get protein from your muscle mass. Okay. Uh, if newborn requires NICU admission shortly after birth and the mother is unable to express breast milk, what are the best alternative milk option to ensure? So it all depends upon a doctor who is in charge of NICU. Okay. My recommendation is to find another mother. Of course, first thing is a mother can be started on Domstal, and you can basically ask her to express every hour, hour and a half, definitely. But we also have now, human milk bank, in a lot of hospital. So it'd be a good idea to basically get those donors milk and give donors milk, which is human. Uh, and then third option will be probably formula milk. But my recommendation is really to another thing. What I do is I ask many times mothers in the last month, 3 to 4 weeks before they deliver, is to start expressing some amount of milk, and that will definitely, so that way she has a good amount of milk flow by the time baby is born. So that would help. Um, yeah, many pediatricians often resort to formula feeding in such cases, but as we learned in our tutorial, formula milk is absolutely, I think that it will be very difficult to confront pediatricians. So what I would recommend is to really kind of teach mothers, or attend to obstetricians, go to their office, tell them that, that you would like to meet mothers before they deliver. So that way you can pass on the right message. You can also talk to gynecologist about problems of, formula feeding. Okay. Uh, Okay, how to address pre-diabetic HbA1c level? Normal fasting sugar, normal fasting insulin, high triglyceride. Okay, so total cholesterol I don't look at. I don't look at total cholesterol. What I look at is I look at total your triglyceride and HDL ratio. So I want TG-HDL ratio to be less than 1. We definitely look at VLDL, very low density lipoprotein. That should be less than around 19. Okay, so around less than 18 to 19. Also, fasting sugar, fasting insulin is important because that will help you to calculate your HOMA-IR. Okay, so the way you calculate your HOMA-IR is by checking your, there is a calculation or calculator available on web, and bloodcode.com, I think. Blood code, let me just write it. Blood. Okay, this is the website. Probably you will find, just make sure, and you will find a calculator where you can check your HOMA-IR. You want HOMA-IR to be less than 1. Okay, so some of those points will help. I don't look at total cholesterol. Your cholesterol may be high. Another thing is that LDL I don't look at, because LDL are two different kinds. You have small dense LDL, you have large fluffy LDL. Now large fluffy LDL is very healthy. Okay, so by looking just at LDL, we won't know what LDL we are looking at. Okay, so what we look at is basically triglyceride HDL ratio. Okay. Hi, Subhangini. Can I use the complementary feeding practices in the video as a reference for my project proposal? Yes, of course, Suma. Definitely you can use it. Uh, what else? Madam, can I use a yes? How to address nipple confusion? That's the issue, Pratyusha. Nipple confusion is a big problem, actually. It's like a shortcut by doctors and lactation consultant. If they don't know how to latch the baby, they said, okay, chalo, start bottle or start, nipple shield or all that. Long way to go to teach them, actually. Main thing is first thing is that definitely avoid nipple shield and bottle nipple immediately. As soon as you find out, you start with the cup and then slowly get baby on the breast, and you'll be able to take baby off, hopefully. Okay. Is it good for a newborn baby to have massage with oil? I would not massage the baby right away. I would wait till the cord falls off. Once the cord falls off, then you can massage the baby. You want to find the oil which baby is not irritant to. Okay, so you can take, say, for example, coconut oil. You can just apply it a little bit on, say, baby's elbow or just around here for a couple of days and see if there is no reaction. If there is no reaction, then you can apply oil. That should be okay. And once you apply oil, make sure that you give a little bit bath and then apply oil, because many times we have a habit of putting oil on when baby is completely dry. That will dry up more skin. Okay, so you want to block that moisture. So you have to moist that skin first. And once you apply that massage, do a good massage, and then you expose it baby to sunlight for a little bit. At least 11 o'clock sunlight, around 10 minutes or so. Not direct. The baby should not be looking in the sun. Okay, but that skin exposure to sunlight will definitely help with vitamin D, and it will improve immunity also. Okay. If a breastfeeding mother gets pregnant, till when she can continue breastfeeding? She can continue breastfeeding even when the baby is born. Okay, and that is called tandem breastfeeding. So what you want to do is you basically so one breast for one child, second breast for second child. Okay, so suppose you have a bigger child will have it from one breast. So that way baby will get fore milk and hind milk. Similarly, the second child will have another breast. So it's again supply and demand. So more demand, more supply. Okay. So you want to make sure that both babies get both the fore milk and hind milk. That's important. With the faculty of GMSR, are on the verge of submitting a research protocol for ICMR, short-term extramural grant. Our protocol is a cluster. Okay. The intervention training of Anganwadi using health control community engagement. Okay, I'm not getting the full messages. Could you please give us some tactical advice in this regard? We also request you to consider if anyone from your team could be co-investigated after going through the protocol. So, okay, definitely you send me the protocol. You can send it to Natasha. And Natasha, just make sure that you write down. Just get the email. You can send us your email and we'll keep in touch. And I'll look at it. Unfortunately, I'm too busy to become co-investigator, but I can see how I can kind of help you. But yes, we'll be very happy to kind of assist you in any of the research that you would like to do, for sure. If breastfeeding mother gets pregnant, that I mentioned already. So as I told you, you continue breastfeeding even if baby is born, the second baby is born. Okay, you don't need to stop breastfeeding at all. Okay. Okay. Any other question? There are many new live lectures which are there, which are part of session number 12 or like the week number 12, where we have explained learning action protocol. We have explained 45 points of counseling. We have explained nutrition counseling charts. So definitely kind of week 12 will be very, very interesting. Another thing is that I'm sure you're enjoying recipe videos, but we won't be asking any questions on the recipe. So I just want to make sure that, you know, uh, you definitely watch it, but, for exams, you don't have to watch it again. Many of those questions are very skill-based questions, so application-based questions. So learn your nutrition, understanding that in certain scenario, what you will do. Yeah. Okay. Okay. If there are, I don't think there are more questions now. So I'm going to end the session. If anybody has any question, you can just type it. Otherwise, we will meet again for the third live session in the month of April. Okay. So, and regarding that, research proposal, definitely kind of get in touch with us, especially with Natasha, and we'll figure out how we can help. Okay. Okay. So I guess I'm going to leave now and see you all. And any question, feel free to put it up on a group chat. Okay.